Hi. So, hi to everyone, and thank you for joining this session. Today, I will be talking about a very important specialty formulation from Dr. Reckeweg R39, also known as Sinistronex. So, this medicine is widely prescribed in homeopathy for conditions related to the abdomen, especially the left abdomen, especially which includes the organs like spleen, parts of the liver, and sometimes even the left kidney. So, in this session, we will explore its composition, the role of each ingredient, the clinical indications, and how it works together as a synergistic remedy. By the end, you will see why R39 is considered a go to preparation for chronic abdominal complaints, also. And this session is intended for the homeopathic practitioners and homeopath enthusiasts, and also the people who are interested to know about this product. So, coming to the slide number two, the disclaimer. The disclaimer is very clear before I conclude or before I start. I want to share a very important disclaimer. This is a very important part. The details in this presentation are provided purely for academic and educational purposes. While R39 is a recognized homeopathic specialty medicine, it should only be used under the guidance of a qualified physician. So, this presentation should not be taken as medical advice for self treatment. Chronic conditions such as splenomegaly or abdominal dropsy which needs careful monitoring, investigations, and sometimes a combination of therapies too. So, if you are a practitioner, always prescribe responsibly. And if you are a patient or a student, remember that professional supervision is essential in homeopathic treatment. So, hope you are very clear with the disclaimer. So, coming to the introduction part. So R39 is not a single remedy preparation. It is a specialty combination designed to cover a broad range of abdominal disorders. Its main focus is on left-sided complaints only, especially involving the spleen. So which is often affected in chronic conditions like malaria, typhoid, or any long-standing infections. But the action does not stop at the spleen. It also extends to the liver, kidneys, and digestion too. Addressing issues like flatulence, bloating, sluggish liver function, and kidney calculi. So all these are the extended abnormalities we may see in the clinicals. So what makes it powerful is the synergistic action. Each remedy contributes something unique, and when combined, they reinforce each other's effects. So, this is the philosophy behind Reykjavik formulations. So, not just the symptom control, but deeper organ support also can work. So, coming to the composition here you can see the exact composition of R39. Notice how each ingredient is carefully chosen for its affinity with abdominal organs. Lachesis and Vespa crabro target the spleen in congestive conditions. Lycopodium works on digestion and liver function. Palladium metallicum is included for pelvic and abdominal weakness, especially left-sided. And Saxifraga is well known for its ability to act on kidney stones and urine gravel. So this is very important combination. Together they are diluted in an alcohol water base with 36% alcohol to preserve the potency. So this balance allows R39 to be both safe and effective for long-term use. Let us begin with the Lachesis, one of the most important remedies for left-sided conditions. Derived from the venom of the bushmaster snake, Lachesis is a polycrest remedy in homeopathy with wide-ranging action. In R39, it is specifically addresses venous congestions and spleen enlargements. So patients who require Lachesis typically present with pain and fullness in the left hypochondrium, a sensation of distension, and complaints that worsen with heat or after sleep. It is particularly effective in cases of post-malarial splenomegaly where the spleen remains swollen and tender long after the acute infection has passed. The Lachesis helps to reduce congestion, improves circulation, and relieves pressure in the abdomen. Next is Lycopodium, prepared from club moss spores. It has profound effect on the digestive system, liver, and gallbladder. Clinically, it is most often prescribed for flatulence and bloating, particularly when the abdomen feels tight and distended after eating. The keynote symptom is heaviness after even small amount of food, which is very typical of weak liver function and sluggish digestion. It also covers gallbladder complaints such as sluggish bile flow and tenderness in the right upper abdomen. In R39, its role is to support digestion and liver metabolism, complementing lachesis in chronic abdominal cases. Palladium metallicum is a lesser known but very important remedy in this combination. It acts on the lower abdomen organs and the pelvis with a special affinity for the left ovary and left lower abdomen. Patients requiring palladium often have weakness, pain, and tenderness in the lower abdominal region. It is also connected to emotional exhaustion. People who push themselves to please others and end up with nervous debility. In R39, it balances the upper abdominal action of Lachesis and Lycopodium by bringing support to the lower abdomen and pelvis, especially where emotional strain contributes to abdominal disorders. Saxifraga, also called the breakstone herb, has been traditionally used in herbal and homeopathic medicine for dissolving kidneys and gallbladder stones. And in R39, it extends the medicine's action to cover renal origin abdominal pain, especially when it radiates from the left kidney or uterus down to the bladder. It helps improve drainage and metabolic elimination, reducing stone formation and relieving discomfort. This makes R39 not just a spleen and liver remedy, but also one that supports the urinary system when abdominal pain is linked to calculi. Finally, Vespa crabro, prepared from wasp venom, acts primarily on the serous membranes and glandular swellings. Its characteristic symptom is burning, stinging pain in the affected organ. In the context of R39, it specifically targets spleen congestion and swelling, often seen in chronic spleen disorders. It also acts on the lymphatic system, making it valuable in abdominal swelling linked with the lymph nodes or glandular tissues. Together with Lachesis, Vespa enhances R39's effectiveness in chronic splenic enlargement, especially when there is a pain and a tenderness. So, what are the clinical conditions where R39 is useful? First, it is one of the most trusted remedies for splenomegaly, particularly when the enlargement is left after malaria or other chronic infections. Second, it addresses pain and swelling in the left abdomen, especially in the hypochondrium. Third, it improves liver sluggishness and weak digestion, helping patients who complain of bloating, flatulence, and heaviness after meals. Fourth, it supports cases of abdominal dropsy or ascites when fluid accumulation is secondary to chronic spleen or liver diseases. Finally, with Saxifraga and Lycopodium, it gives relief in gallbladder and kidney complaints that contribute to abdominal pain. So, standard dosage of R39 is 10 to 15 drops in little water, then 2 to 3 times, taken 2 to 3 times daily. In acute or severe cases, it may be repeated every 2 hours until improvement begins. after which the dose can be reduced. However, for chronic condition like splenomegaly, treatment often needs to continue for several weeks or months, always under physician supervision. This ensures both safety and effectiveness, especially in case of organ enlargement or long-standing digestive issues. So thank you very much for everyone. So in conclusion, R39 is more than just a symptom relieving medicine. It is targeted organ support remedy that works on abdomen, especially the left.